Osan City had long been facing a quiet yet persistent threat: childhood infectious diseases. Chickenpox, mumps, and scarlet fever, these three major illnesses alone accounted for 73% of all reported infections, with 95% of cases occurring in children under the age of 10. But the problem was not just the frequency, it was the recurrence. Infections often spread between siblings or from child to parent within the same household, forming a never-ending loop. To break this cycle of suffering, Civic introduced a completely new approach, one that went beyond traditional administrative statistics. The key was to focus on the household unit. Civic built a high-resolution household big data system for all 90,000 households in Osan, not limited to addresses or population, but incorporating lifestyle patterns, economic behavior, and care characteristics of each family. From income levels and consumption patterns to financial assets and debt structures, number and age of children, psychological tendencies, and types of care support. This comprehensive dataset of over 600 variables became more than just statistics. It became a map of household health risks derived from data. The next step was prediction. Using machine learning, Civic analyzed which types of households were more likely to experience childhood infections. Among 6 tested algorithms, including random forest, decision tree, and SVM, the random forest model was selected for its outstanding performance, achieving 97% prediction accuracy and ROC score of 0.99. But this model did more than offer neighborhood-level statistics. Even within the same apartment building, on the same floor, and with identical square footage, the likelihood of infection varied depending on factors like household income, after-school education spending, credit repayment methods, savings levels, and cultural activity expenditures. As a result, Civic was able to identify 2,445 high-risk households, approximately 8.3% of all households with children under 10 in Osan, before any outbreak occurred. And it didn't stop there. Civic also uncovered the spatial factors most strongly associated with disease transmission. The number one factor: childcare centers. Facilities such as home-based, private, workplace-affiliated, and public nurseries, specifically their number of classrooms, enrollment capacities, playground access, and staff size, were all highly correlated with infection clusters. Additionally, everyday businesses like beauty salons, veterinary pharmacies, golf ranges, and bakeries also repeatedly appeared in infection-prone areas. Based on this analysis, Civic developed a 500-meter grid-based risk map, offering a much finer resolution than administrative districts. This map revealed the exact distribution of high-risk households, pinpointed vulnerable daycare centers, and even identified specific apartment units with past or predicted cases. Infection prevention activities no longer relied on broad assumptions. Flyers were distributed only to high-risk households. Sanitation inspections were prioritized for vulnerable childcare facilities. Outreach campaigns were timed precisely for April and November, the months when outbreaks historically spike. But Civic's AI system goes even further. It doesn't just predict risk, it explains why a household is vulnerable. For example, a low-credit, multi-child family living in a small apartment with low education spending is far more susceptible. Conversely, a household with stable employment and high spending on cultural enrichment tends to have lower risk. This kind of interpretability makes it easier for policymakers to both design and justify their interventions. Civic's system is not just a tool for disease prediction. It marks the beginning of a new urban governance model where data defines policy and AI operationalizes public welfare. With household-level risk modeling, administrative resources for welfare, childcare, public health, and education can be allocated with maximum efficiency and precision. Through this system, Osan became the first city in the nation to pilot an AI-based infectious disease prediction model built on household big data. It elevated the realism of policy, strengthened the scientific foundation of administration, and most importantly, laid the groundwork for protecting children's health not by guesswork, but by data. Cities are now reaching a level where they can read data, predict threats, and autonomously design their responses. And it all begins with understanding the fabric of everyday life through household big data. Civic is building a nation where every child can grow up safe from infection,